Well, thank you everyone for joining us. I'm Kim Ash and welcome to today's Facebook Live Q&A with UVM Children's Hospital. Today, we're talking about the COVID-19 vaccine for children ages 5 to 11. On Tuesday, the Centers for Disease Control and Prevention officially endorsed the Pfizer coronavirus vaccine for this age group. Today, we're here with Dr. Lewis First, Chief of Pediatrics at the University of Vermont Children's Hospital, and pediatric critical care physician, Dr. Rebecca Bell, who is also president of the American Academy of Pediatrics Vermont chapter. Welcome to both of you, and thank you for joining us for this conversation. Let's start with, what do Vermont pediatricians think about the recommendation from the CDC that children ages 5 to 11 be vaccinated?
Well, I'll start with that one, Kim. First of all, thank you for having us on this Facebook Live, because it's really an ideal way to share information with each other and get questions answered, which is so important when we're talking about this vaccine. Now, you asked, what do pediatricians think? Pediatricians love it when children feel good. When children feel good, pediatricians feel great. And we now have a vaccine that has been proven safe and effective through incredibly strong science, lots of data, a vaccine that's been given millions of times to teenagers already, to adults, where we know that a vaccine can prevent the severity of COVID, which still occurs in infants, children, teenagers, all of us, from reducing hospitalizations, reducing severity, reducing deaths. We have all of that, and we know that the benefits of this wonderful scientific advancement far outweighs the risk. How can we not be feeling terrific about the fact that now our 5 to 11-year-olds are eligible for this vaccine? Not only will it do all the things I just referred to, but most importantly, for our children, it will bring normalcy back to the lives that we need them to have, and indirectly will also help to normalize all of our lives as well. When all of that happens, as a pediatrician, as a dad, as a grandfather, this is a great moment for us in the trajectory of this pandemic that is going to make a very big difference. And I'm sure, Dr. Bell, you can, as enthusiastic as I am, I'm sure you can take it even higher.
Yes, we are so excited. We were thrilled in the spring when our patients 12 and up were able to be vaccinated, and felt so much relief that so many of our adolescents in Vermont were vaccinated over the spring and summer. And as Delta has come through into our community, into our state, our adolescents are really protected against serious disease. And that's a big difference when we compare Vermont to other states. So pediatricians in Vermont have felt really relieved that that portion of our patient population has been really well protected. And we are so excited that that is now going to be extended to younger children. Parents have been waiting for this and asking for this. And I think have been patiently waiting for this. This is really much anticipated development. And I will say it speaks to the scientific rigor, right? People have been asking for this and begging for this since the beginning of this. And so I think we've all been able to watch how careful and how thoughtful the process has been in real time, and understand what the rigor is around vaccine authorization.
That's great. Go ahead, Dr.
I was going to add one more piece, which is both Dr. Bell and I come across strongly advocating for the vaccine, but no one's going to argue we want the best things for children. We're also not going to argue that this is a journey that we need to feel comfortable on. And we as pediatricians are here to partner with all of you watching this Facebook Live, with your pediatrician, your family physician, your physician assistant, whoever you're comfortable with. Let's journey together to get the questions answered. I'm sure you're going to ask questions today that we can't answer, but we are determined to help get those answers, but in the setting of something where I will reiterate the safety, the efficacy, the benefits are outweighing the risk. And that's why we are so passionate about wanting to work together. We're not going to leave you if you're hesitant. We just want to be with you to try and understand where that sits and how we can learn together. So I just want people not to feel that this is, we're selling a product, we're selling the wellness and the health of our children and our community, but we do it together.
I also think it's important to mention that COVID is not, children are not without risk getting COVID and getting serious complications from COVID. And I wonder if you can speak to what some of the acute and chronic complications are when young children have gotten COVID, what we've seen.
Dr. Bell, you want to start?
Yeah, I can start with some of the acute complications of COVID in children. And so I really kind of think about it as a spectrum on the age spectrum. So when infants get COVID, what we have seen when infants have to come into the hospital is that this is related to them having high fevers, some inflammation, really not feeling well, not feeding well at all, and perhaps needing some IV hydration and some other types of support. And so sometimes infants will get sick in that way. I'll skip to the adolescents because I mentioned how we've been feeling really lucky that our adolescents have been so protected. So especially during this Delta wave, as more children are getting exposed to COVID all over the country and more children are getting sick from it, we're really seeing lots of hospitalizations across the country among adolescents with really serious COVID pneumonia. So just like we see in adults, we see lung damage, we see adolescents needing lots of oxygen to support them, sometimes needing help to breathe. So that may be something like something that can actually give them pressure to help them breathe. And what we have seen in adolescents, even healthy adolescents, that we know happens in the adult world is this really long recovery from this COVID pneumonia. So just like needing oxygen for a long time. Sometimes the heart can be affected too. That's a condition called myocarditis, where the heart can be inflamed in the setting of COVID infection, and really reduced exercise capacity among even some of our really healthy adolescents. And so that's something that really worries us. Similar to adults, children with acute COVID infection, because they have so much inflammation, can have blood clots. And so they oftentimes need blood thinners. And what we're doing in the hospital is really trying to lessen the damage that the child's own immune system is doing to the body. And so things that we use in adults like steroids and some other therapies that help kind of control the immune system, we give to children as well who need it. And then I left the sort of the school age children last, because that's really the age we're talking about in terms of vaccination. And a big thing, if you've watched any of the FDA or CDC coverage, is looking at what is COVID infection like in this age group. And this is the age group, although it's, any child is susceptible to this, but this is the age group where we see a rare but pretty serious complication of COVID-19 infection, which is something called MIS-C or MIS-C, and that stands for multi-system inflammatory syndrome in children. And that's when children have a COVID infection and then some weeks later develop this inflammatory response. They get so sick they need to come into the hospital, and then they might need organ support. And so there have been more than 5,000 kids across the country who have met criteria for this condition. And it's a pretty serious condition. Like, you have to be in the hospital. Oftentimes they're in the ICU. Oftentimes they're needing support, like support for their heart or support for their kidneys or some other organ. And so when the CDC and the FDA were really looking at this vaccine, they were comparing rates of COVID hospitalizations in this age group, the 5 to 11 age group, and looking to see, what are we seeing kids get sick from acutely? What are they going to the hospital for? And sort of in weighing that in their decision. So we always hear that kids don't get as sick as adults do, right? But they still do get sick, and we still want to prevent serious illness in children. And so that was part of the decision-making around the vaccine. And a lot of it included this serious sequelae of COVID called MIS-C. And then I'll turn it over to Dr. First to talk about other things we're seeing with COVID.
Well, thanks, Dr. Bell. When you say, and Kim, you had asked the question, people say, well, this is so low risk. Well, first of all, as you just heard, low risk doesn't mean no risk. And so we are seeing children, even in our children's hospital in this state, who are having some of the serious acute conditions that can result as a result of getting this virus in your body. But we're also seeing something called long COVID or long haul COVID. Now, this is something you may have heard about in adults, and it is occurring in teenagers. In fact, it's occurring in children in the age group that we're now vaccinating. There have been a couple of studies that suggest that 10 to 15% of children who experience COVID will also or potentially will experience long COVID. What does that mean? It means you may have minimal symptoms and not come in the hospital with your COVID. You may say, I did fine. And then 4 or 5 weeks later, you start to feel more fatigued. You have headaches. You may have a cough, difficulty breathing. You may feel like your brain is fogged up. And this is, again, a reaction, an inflammatory reaction to this virus that may not be serious enough to put you in the hospital, but it's going to affect your ability to play a sport, to participate in school. I guess a good way to think about it, it's like mono. When kids have mononucleosis, it takes weeks and weeks to recover. And that is an inconvenience, obviously, to a child. And we're talking, this is occurring as young as we've seen kids who are not themselves even in toddlerhood, all the way through adolescence, and particularly in adolescence and young adults. It affects families because they know their child is not right, and it can last for weeks to months. So again, this is not something that's going to find a place in our children's hospital in terms of an inpatient admission, but it is a complication that we can prevent. We're certainly not seeing these symptoms in association with receiving the COVID vaccine for our teenagers, for our adults, and certainly the expectation will be the same. And another great reason to give this vaccine to our 5 to 11-year-olds, preventing long COVID from occurring. And it's not rare.
I'm going to just jump in with a follow-up question that's related to what you just said, Dr. First. We have a question from a viewer saying, can you compare the potential heart problems from the vaccine to potential heart problems from actually contracting COVID in this age group?
We can, Dr. Bell, since you are in critical care, I think you can start with this one, and I'm sure you'll take care of it. But if not, I'll add a couple of comments.
Yeah, I'm so glad somebody asked about that, because this is one of the frequent questions that we're getting. So yes, we can compare. And one thing that's really important to know is that for sure, COVID infection causes myocarditis or inflammation of the heart at a much higher rate than does the vaccine. And I'll talk a little bit about the difference between the two. And the other important thing to know is that the vaccine-associated myocarditis, which is very rare, it is mild compared to the clinical picture we're seeing in children who have myocarditis from the virus. So I'm going to back up a little bit just to explain what we know about vaccine-associated myocarditis. So this is something that's so rare that millions of people have to get the vaccine before we start to notice it. So this was something that was picked up through, even after a vaccine is authorized for use, there are many different surveillance systems that continue to occur so that we're watching for extremely, extremely rare side effects. And that's how this was picked up. So myocarditis, again, inflammation of the heart muscle, and pericarditis, which is inflammation of the lining of the heart, is something that we see all the time. It's not very common, but it's something I see in my practice before COVID even happened. So it's oftentimes associated with a viral infection. So influenza, parainfluenza, adenovirus, Coxsackie virus, all of those viruses, I personally have seen children have myocarditis, and sometimes very, very severe clinical courses, like it affects the way the heart works. So we know that viruses can cause myocarditis in children. So what we were noticing, what the surveillance systems were picking up on, was that there were, especially among teenage boys, teenage males, that the incidence of myocarditis was a bit higher than what we normally see at a population level. And what they were seeing was, especially after the second dose, so in the week or two after the second dose, that there was an increased risk of of people having myocarditis. And so looking at all the numbers, it was determined that this is a side effect from the vaccine. It's happened so rarely that even when if you look at the whole population, you don't notice, you can't see it at all. If you look at just say older teenage boys and just look at that population, the chance of vaccine associated myocarditis after the second dose, so like looking at the most high risk, it's 0.007%. So it's very, very, very rare. It is much more common to have myocarditis with COVID infection. Still rare, but more common than the vaccine. And then again, what's really important to me as a critical care physician is, myocarditis can be a spectrum of things. And so the vaccine associated is mild, people recover fully, whereas myocarditis from the actual virus can be much more severe. So what about the 5 to 11-year-olds? Well, that trial, that clinical trial included 4,600 children in that age group, of which 2/3, so just over 3,000, received the vaccine. Of those 3,000, nobody had myocarditis in that group, which we wouldn't be surprised about, right? We know it's so rare that you probably wouldn't see it in just 3,000. And so when the FDA and the CDC looked at the question of, is this vaccine going to be helpful for children in this age group? What they did was they actually used the numbers, the incidence rate for these older children of that, 0.007% that I mentioned, and plugged it into a formula to really assess the risk and benefit. And not to go into it too much, but we really think that this younger age group would be even less likely than older children to have myocarditis. So these numbers were very conservative. And still, when they ran that risk benefit analysis, the benefits of the vaccine far outweighed the risk, even using those high numbers. So, if you're worried about myocarditis, I'm worried about myocarditis just in general. I don't get your kids vaccinated. So definitely the vaccine will help protect them from COVID infection related myocarditis.
I'm just gonna, first of all, thank you, Dr. Bell, for getting to the heart of the matter. And also, what you just demonstrated was where we all are. You use data, you use the science, you use the numbers to say there's a lot of emotion that rides around the pandemic and around this virus. But what we have to do is sort through that and be able to talk with our families and with our kids about what you just said, but it's anchored on science and data that allows us to make the decisions and make the statements that we're making in guiding families and our children to stay well through this vaccine.
And speaking of science, I wonder if you could just give us all a brief little lesson on how does the vaccine actually work?
Dr. Bell, again, you've got a great way to do this, so I'm going to turn it over to you.
Sure. So all vaccines work similarly. Like the big picture is that the vaccine presents information to your immune system in a controlled way so that the immune system can learn about a specific pathogen, a specific virus or bacteria, and build up an immune response so that your immune system then has some memory. And if you're ever exposed to that virus or bacteria, your immune system's ready. It's not starting from scratch. So when we're talking about COVID vaccine in children, we're specifically talking about the Pfizer vaccine. That's what's available to children. And that is something called the mRNA vaccine. So both Pfizer and Moderna use this technology. So mRNA technology has been in place for decades. And the way it works is that I like to say it gives a recipe to your body, to your cells, to say, here's how to make a spike protein. So we've all at this point seen the picture of the coronavirus, right? With like it's supposed to look like spikes on a crown. That's where it got its name. And so then your body will make not the virus, right? It makes just that protein, and your immune system sees it, reacts to it, right? That's kind of like some of us especially after our second shot, kind of felt like we had some fevers and chills, and that's our immune system responding to that spike protein. It has some time to build up a response. And that's in contrast to if you get sick, if you get infected, your body's doing that, but also the virus is actually replicating in your body. So your immune system is trying to catch up. So here it's just presenting a piece of information, and your body makes the spike protein. Now the question is, how long lasting is this? So the mRNA just disappears, right? It just goes away very quickly. And that was actually one of the biggest challenges in creating these vaccines, is that the mRNA disintegrates so quickly that they're having a hard time just keeping it in the body long enough to like give the information. And so that's why it's sort of wrapped in that fat bubble, so that it lasts a little bit longer. So hours to a couple of days is the length that the mRNA will stay in your body, and then it just goes away. So what's left is your immune response. And what pediatricians love about vaccines is that the vaccine isn't changing anything about the way your body works. It's a lot different than a therapeutic, like a medicine, which might change a pathway. It might, change the way your body's working in a way to help you. But the vaccine doesn't really change anything about the way your body is reacting. Your body reacts exactly the same way as it would if it was a real pathogen. It's just giving information. There's no virus in it. And then your body just acts like it normally would. And so that's sort of the big picture of how these vaccines work. And I'll hand it over to Dr. First.
I'm gonna borrow something that you've taught me, Dr. Bell, which is, as parents and grandparents, this is sort of a bigger picture of how they work. We wish we could protect our children against everything. I mean, we want to protect our children, but the truth is we can't do that for everything that they're going to encounter in their lives. So what do? Whether we're in school, sport, we prepare them for life. We prepare them for whatever's going to come down the pike. Vaccines are preparation for dealing with the adversity of the coronavirus. Instead of letting the body say, what is this thing? I'm going to react. I'm going to have this giant explosion of a response. The vaccine says, okay, I'll take the spike protein. I now see it could get into my body, and I'm going to prepare to deal with it if it ever comes back again in a way that won't hurt the person where I'm making this response relative to what this virus could do if it just knocked on my door and I'm not protected. So vaccines prepare you for what's going to happen. So when the next time it occurs, the body recognizes it, takes care of it much more directly without harming other aspects of the body, such as the heart, the lungs, and those other areas. So I always like to think of vaccines as great preparation for dealing with adversity, even if, again, somebody may not be fully protected with this vaccine, but they're going to be better prepared, which is why the severity is so much less when you get the shots than it is if you experience COVID without a vaccination. How'd I do, Dr. Bell?
Great. Yeah. And I just want to add to that what we're doing in the hospital when someone has a severe case of COVID infection is we're actually, again, trying to control the patient's immune response, because that's the problem. It's what I say, it's a really unprepared immune system, right? And that's the issue. The issue is not so much, if you're exposed to the virus and you've been vaccinated and you start to have mild symptoms and your body has recognized that the virus is there, and it's already starting from a place where it's already made some cells to kind of get rid of it and to control it. And that's the mild case that we're sometimes seeing with people who've been vaccinated. But really what we worry about is a totally unprepared immune system that can just respond really overreacting. And those medicines that we're giving in the hospital are about calming down this unprepared immune response. So we want to give our children all the tools they can have to really to react to this virus. And the other thing is that they will be exposed to this virus. So I think early on in the pandemic, the question was for some people and some families, well, maybe we can just, we'll wear a mask, we'll just be careful, and other people will get vaccinated, and maybe the virus will just go away. And unfortunately, that's not the case. The virus is really here to stay. And so our children who have long lives ahead of them are definitely going to be exposed to this virus, probably over and over again. And so we want their immune systems to be as prepared possible for when they are exposed to the virus.
That's great. That's a really great explanation that really visualized it for me. It's like teaching our immune system to respond appropriately to what the vaccine is doing. We do have some parents writing in that maybe they're a little bit on the fence and they might like to see more children get vaccinated. They don't want to be early adopters on behalf of their children. They'd like to see a few thousand more children at that age group be vaccinated to make sure all the data holds for safety. What guidance would you give to those parents who are sort of on the fence and wanting to see more children ahead of theirs get vaccinated and see how that is working?
I'll start and then turn it over to Dr. Bell, except to say this is not something we just decided to do. Every step of creating this vaccine has been thinking about collecting what parents are asking. Do we have data to say this is safe enough for our children? So a couple of points. Obviously, as I started earlier on in our conversation, this vaccine has been given millions of times to teenagers. We know the level of immune response that successfully prevents the virus. What we then discovered in the tests with about 3,000 children who were in the Pfizer studies, that giving the dose that we give for adults actually causes a great response, but it causes some of that, it causes a little bit more of the achiness, the fevers, et cetera. And the question was, could we do that with less of a dose? And it turns out that kids' immune systems are terrific and they're ready to prepare. So at a third of the dose, we get the same response that an adult or a teenager gets from what they're receiving with this vaccine. And the hope is by reducing the dose, you are already reducing the chance for any other inflammatory responses to making the antibodies to the spike protein. So that's a key point along the way. And again, when you say you tried it on 3,000, we didn't get there until we did the dose adjustments. We looked at a variety of children getting this and the millions who had gone before these 3,000 children. And then we look at who's getting COVID with the Delta variant. And we look at those numbers and we know that there have been 1.9 million children already between the ages of 5 and 11 who have been infected with COVID. Okay, it's about 10% of the cases in this country right now, and it's making up a higher percentage after we vaccinated adults and teenagers. There are at least 8,000 to 9,000 children hospitalized right now, and I don't want to throw the numbers, and there have been about close to 100 deaths in this age group. So we can wait and rather have the discussions while we're waiting to hope we can get the questions answered, because we're not going to put children through experiments until we know that they're going to be safe. I value the children who went first, but to go now to get emergency use is because of what we're experiencing with children as their numbers are going up, even if the adult numbers are going down. Dr. Bell?
Yeah, I'm a numbers person and I find a lot of comfort in numbers and data. And so in the spring, we heard this is a very common, response is, I just want to wait. I just am going to wait a little bit. And in the spring, we heard this a lot. Also in the spring, there wasn't as much COVID in Vermont or in our communities. But eventually 80% of 12 to 17-year-olds in Vermont have gotten vaccinated. And this is with the same, it's a Pfizer vaccine. So it's 31,000 Vermont adolescents, and they join around 13 million US adolescents who've received the Pfizer vaccine. More than 100 million people in the US have received they've received 2 doses of the Pfizer vaccine. And that has been going on for more than a year, right? So we have a lot of data. We have a lot of data from adults. We have a lot of data from adolescents, remembering that 16-year-olds were able to get this vaccine early on. So we have a lot of data from that. These are really the most closely watched vaccines in the history of vaccines. And, this is, I sometimes have to, I recommend and I prescribe and I give medications in children in some cases who are sick. And we don't have a lot of data, sometimes, and it's just, we have to weigh the risks and benefits. For me, this is something like 100 million people just in the US have received this vaccine. I mean, those are some reassuring numbers. I have a 6-year-old and he has has an appointment to get vaccinated next week. I'm very excited about it. To me, this is like the risk benefit for me is super easy. This is like one of the easiest decisions, but I understand it's not necessarily the case for everybody, and that's why we're here. What's interesting about the vaccine trials, and this is true in adolescents, adults, adolescents, and kids, is that there were a lot of clinical trial volunteers, the people who were involved in this research. We had so many people signing up, and a lot of them were physicians or other healthcare providers who've seen COVID. Lots of people were volunteering to be in the clinical trials. Lots of pediatrician and doctor parents were signing their kids up to be in the clinical trials. And so I think that's also a very reassuring sign as well. So I know that there's a sort of hesitation, of course, which is why we're doing this and why we want to talk to folks. But I also, and that's why it's really imperative that we have these conversations now, because not vaccinating is a choice too. And so understanding what are my choices here as a parent, what are my options, what is known, what is uncertain. And what we're saying, those of us who are taking care of kids with COVID, the virus poses the most uncertainty. The virus and what it's doing to our children's bodies, that makes me nervous and worried, not the vaccine. And so understanding what are the unknowns, where does the greatest degree of uncertainty lie? It's these kids are getting so sick, and what do things look like for them, months and years down the road? There's still a lot we need to learn about the virus. And to me, that is my worry and uncertainty is around the virus.
A quick add-on question came from a couple of folks around their children did get COVID. Are there risks? What are the effects of getting the vaccine after just having had COVID?
So I'll start, but that has also been looked at in, again, adults and teenagers who have had COVID and looking at their immune systems. And it's not, even though you make antibodies to the virus when you are actually infected, they're not necessarily of the strength to prepare your body for a future infection. So it has been shown again with data that the protection, that there are stories in the news of people who got COVID and got COVID again. So the CDC and the Food and Drug Administration strongly recommend that even if your child has had COVID, to still get the vaccine, because the strength of the antibodies that prepare your body is far greater than what you're going to take a chance on, hoping that the protection you get from your infection, even if it wreaked havoc in your body, is going to be strong. There's no correlation between how sick you are and the level of the antibodies you make. We do know the level of antibodies we're making from this vaccine. Even at a third of the dose needed for an adult, we can make that level of strong antibody.
Would we expect different side effects for a child getting the vaccine after having had COVID compared to a child who hasn't had COVID and gets the vaccine? Do we know?
Belle, you want to go?
No, and I think that's true of adults as well. I think everyone sort of responds a little bit differently, both to the vaccine, whether they have those, what we call systemic side effects after the first dose, after the second dose. So I think what's important is that, as Dr. First said, is we can't tell. It is unreliable what somebody's infection-induced immunity might be. So it would be easier if we could say, well, if you got really, really sick or you had this degree of serious illness, then that was terrible, but you're now protected. We can't say that, because actually people who've gotten really sick don't have long lasting or sometimes really any type of infection induced immunity. So we can't really pinpoint that. So the most reliable way to gain immunity is through vaccination. And we do know that people who've have had COVID and then been vaccinated are very well protected from reinfection. And the reverse is true too. So somebody who's been vaccinated, if they're later exposed, that's another way that their immune system kind of sees the virus again and can react. So what we would like is that, as much as possible, for people to be vaccinated and have vaccine immunity. because that's the safest way to get immunity, because you don't have to get sick. It's very controlled, it's very reliable, and we know what that looks like. So that when they're exposed again in the future, or exposed for the first time or again in the future, that they're sort of ready for it.
How do we prepare this age group for the actual shot, especially if they're nervous? Dr. First?
I love this question. I mean, it's how do we, I think the most important word you said again is prepare. I think right now, because this is so in the news, our children are going to have questions, or they're going to hear about it from friends at school, and some of their friends are going to get vaccinated. So the first thing we need to do is not blindside our children and say, we're going to take a little ride and go see we're going to go to the school and get a surprise. Let's first of all see where our kids are at and talk with them, not at them. Help them understand and what this vaccine is all about, why it's so important, and make our children, empower them to be part of the solution. All caregivers, parents, grandparents, I hope you will, if you're going to vaccinate your child, and we certainly hope you will, that you speak positively about this, saying things like, oh, I know, you can be real that there's going to be a little bit of a pinch, but the good news is you're going to be able to do all the things that you love to do until we had to stay at home or wear masks for indoor activities, and we're going to normalize the lives. And in addition, they can be heroes. Talking to children about the fact that by getting vaccinated, the people they care the most about will be even further protected, because they're not going to be someone who is going to hopefully harbor that virus. They still may, but not as long, and not be as much of a spreader as we think those who are unvaccinated can be. I think that's another plus. When they go for the vaccine, give them some choices, empower them. Which arm would you like? Have them, if they're younger, bring their transitional object to go with it. You might even pretend to give the shot to the stuffed animal to say, look how much healthier the stuffed animal looks. But when you go, where would they like to sit? Some kids like distraction. I love the little trick where a parent's thumb becomes a candle. And when the thumb pops up on 1, 2, 3, they blow out the candle. And when they're focused on blowing out the candle, you give the vaccine. And it's good to say, if you feel a little bit of achiness, or you feel a little bit of, you don't feel like yourself in the next couple of hours or the next day, that's a great sign that the vaccine is now preparing your body so you're not going to get any sicker. And we're going to be able to go to school and do all the things we want kids to do. In fact, this is another way to make sure that we can focus on the indirect, which is getting kids and keeping kids in school, getting kids to play sports, getting kids to see their friends, getting kids to do all of the things that make our kids kids and bring wellness into this community. So if you can approach it from a positive frame, be positive, give them some control, give them some things that will make them feel good, and then celebrate after they've gotten the vaccine. Take a picture, send it to relatives, tell everybody, I got my vaccine, take that, COVID. I think it will be it'll be a great family experience. Dr. Bell, you want to add anything?
Yeah, I just remind everyone that we're all getting vaccinated, right? So I think talking about that, talking about your own experience getting vaccinated, we've been celebrating everyone in our family and all our loved ones getting vaccinated as this has been rolling out for the last year. And so this makes children feel like they're a part of something, and that this isn't directed, just toward, we're not asking them to do something. There's so much that we tell children to do that's like just for them, right? They don't want to do it, and we say, no, you have to do this. This is something that we're all doing. And I think that is really helpful as we're making recommendations to get vaccinated. We've vaccinated ourselves. We're vaccinating our own children. Some of my favorite stories over the past few months are all of the 6th grade teachers who tell me that it's this rite of passage in their classrooms where an 11-year-old turns 12, right? Because up until now, you have to be 12 to get the vaccine. They come into school and say, I turned 12, I got my vaccine. And so that's been very exciting. I think young people are really understand what's going on. I think sometimes more than we give them credit for, and want to be a part of the solution, and want to protect themselves too. So I think just sharing your own experience and the experience of others, this is something we are all doing to protect ourselves.
Right.
Hopefully you probably gave kindergarten teachers a great idea just now for rites of passage, because we're going to drop it down to age 5, which I think is great.
We've had several parents write in wondering, should they schedule the vaccine for their young child over the weekend so they don't miss school from any side effects? What are your thoughts about that? And then to piggyback on that, one parent was concerned that their child might not be able to articulate if, there was a rare, more serious side effect. And so just wondering what guidance our pediatricians, our expert pediatricians would give these parents.
Dr. Belt, you want to start?
Yeah, so that is a great question, because when all the adults, especially younger adults, were getting vaccinated, we were suggesting to folks, your second dose, you may feel pretty run down the next day with fevers and chills and muscle aches. So think about how to schedule your work week and other commitments around that. The good news is that this pediatric preparation, this pediatric dose, which is 1/3 of the adult dose, is in the children in this age group, the 5 to 11 age group. They're reporting much lower rates of systemic symptoms. So the data from the 3,000 kids that received it, there was, I think it was 6% reported fevers, is really low. There was some fatigue and some headache were the most common, but still way less than the 16 to 25-year-olds. It's probably because the dose is lower. So I actually don't think that we need to go way out of our way to schedule things thinking that they're going to feel really run down the next day. And I should also mention that even among the children who said, yes, I had fatigue or headache, it was mild. And so they sort of rank it based on, did it interrupt your day or cause a problem with the day? And the answer was really no. And then it went away in a day or two. So we should actually see less of that. Very, very common is a sore arm the next day, sometimes redness and swelling. That is very common. And we want to, prepare our children for that as well. But the really needing to stay home from school, I don't think we're going to see that as much as we did with the adolescents based on the data we have. So I would say just go ahead and get it whenever it's convenient for you and your family. And, sometimes kids do, they get sick all the time and have to stay home from school. So I don't think I would go way out of my way to schedule it around the potential for systemic symptoms, because we're seeing so little of it.
I would just reiterate, what works for your schedules is when you should schedule it. Tell the teacher, just send a note that my child got vaccinated yesterday. If for some reason you sense that they're not on their game, please let me know. Or you know your children best. The good news is it's better to have that happen, although we want kids in school, than to have them get COVID and be out for 5-10 days or even longer, because one day missed is much better than, as you know, what happened here last year, where we're talking weeks and months of where we couldn't be in the classroom. So the most important thing is, if there's an open slot that works for you, if it's on the weekend or the weekday, take it and realize that it's going to be unusual to have some side effects. They'll be short lasting, they'll be mild, and your child will be up and at them pretty quickly, which is what's happened to many of us who have gotten, a number of us who've gotten the shot. Many have gone right back to work and have no problems, and others took a day, but then they were back within 48 hours.
I think this will have to be our last question for our live session. However, we will be answering in follow-up all the questions that folks have posed during this live. So we've talked about short-term side effects, wondering if there are any long-term effects that parents should be concerned about.
Yeah, I can start. So I think going back to what is a vaccine? What does it do? How does it react in our body? So this is, again, just like any vaccine, you get the vaccine, it presents information to your body, your immune system then responds. And in this case, it's mRNA just disappears. So there's no long-lasting pieces of the vaccine that stay in your body at all. So with vaccines, again, it's not like a therapeutic or a medication. It's not something you take every day for a long period of time. You get it once, your body reacts, goes away. So we, in all of vaccination, we see side effects that can happen sort of right away, within a few days, or within a few weeks. So 6 to 8 weeks would be the longest we would ever see a reaction to a vaccine. And again, that's related to how your immune system might respond to the vaccine. We never see anything that would just show up 5-10 years down the line. This is a question parents are asking us a lot. So I'm glad people ask, because as a parent, you want to make the right decision for your child. And that fear of that sort of unknown can be hard to get over. But what's so interesting about this is that, so every vaccine that has ever been developed, I mean, pediatricians are used to having this conversation. There's always this question, well, what if there's something we don't know, and in 5 years, there's this problem that my child has because they've been vaccinated? So this is a question we get with every single vaccine. There's always lots of misinformation about really scary stuff that people hear on the internet around things like fertility and development, and that kind of misinformation, we've seen it with other vaccines too, not just this one. And the problem is that it's hard to reassure families about it, except to say, like, we don't see long-term effects with vaccines where, you get the vaccine, you're fine, and then something shows up later. And there's no biologic reason why that would happen. There's nothing that's happening with vaccination that would create that issue. And, one of the things I think about a lot is just how pervasive this kind of concern is, where, I might prescribe a course of antibiotics to a child, and the family might say, okay, what are the side effects they might experience taking the antibiotics? I've never had a family say, in 5 years, will this affect their fertility, right? Never. And both, that's it's not possible, it's not biologically plausible, but nobody asks about that. But some of the misinformation around long-term effects is like really stuck on vaccines. And so that's something we're happy to talk to families about, but we feel really reassured that there's no real biologic mechanism by which that would happen.
I'll make two quick closing points. One of the things I get to do is edit the National Journal for the American Academy of Pediatrics called Pediatrics. So I'm seeing thousands of studies a year crossing my desk. And as Dr. Bell said, we have yet to see a study of long-term side effects of any vaccine, okay, beyond the first a couple of weeks, where you'll start to see a problem with some of the other vaccines that has been taken care of with improvements in vaccines, or even vaccines that have been pulled back, but it occurred in the first 4 to 6 weeks of putting a vaccine out there. And this vaccine's been out for now almost a year in terms of adults, and tested before then. The second point is just to note the fact, what a great time to end to say, well, COVID is one vaccine. We have many others that also prepare the body, and you do not have to stagger. I mean, flu season is here. This is a time, if you're going to your healthcare professional and you haven't gotten the flu shot, you can get both done at the same time, and tell your child how healthy they're going to be as a result of taking care of not just coronavirus, but the other vaccines they need to keep them healthy and move through this winter season. That was a plug for all vaccines.
I love it. Thank you so much to both of you. We really enjoyed getting all these great answers and really detailed information. Thank you very much, and we'll talk to you again soon.